The HIV epidemic continues in Texas, driven in part by untreated psychiatric conditions. People with depression and other mental illness comprise a growing proportion of individuals living with HIV. Individuals with mental illness are particularly vulnerable to infection with HIV because of several factors, including the higher prevalence of poverty, homelessness, high-risk sexual activities, drug abuse, sexual abuse, and social marginalization found in this population. People living with untreated mental illness and with HIV are less likely to be tested and to begin life-saving antiretroviral treatment. Mental health care that includes routine HIV testing can improve health outcomes and decrease risks by diagnosing and treating HIV earlier, and by treating mental health issues that interfere with medical treatment.
HIV testing in the mental health arena is something that is up and coming, if you will. HIV can present as cognitive problems. HIV can first present as psychiatric illnesses. Anybody can walk through your office and be HIV positive. So as it is going more towards becoming the standard of care to have screened your patients for HIV, just like we screen them for a number of other illnesses. Two benefits of knowing your HIV status, which is why everybody should be tested, would be that if you find out you are HIV positive, the earlier we intervene with treatment, the more effective treatment is, and in today's cost containment setting, the cheaper it is. The other thing, too, is that if people know their status, that would allow them to think through and modify their behavior if they want to do that. At one point or another in the course of their illnesses, the people that we treat have difficulty processing the consequences of their behavior. They're more at risk than what the general population would be. It's a matter of also building awareness in our own center about HIV, about why that's a good thing to do in the center, about how HIV impacts psychiatric treatment, about how HIV can present as psychiatric issues. HIV can be a neurological process, and there are many neurological illnesses that can present first as psychiatric symptoms, oftentimes as depression, or can appear like depression. Sometimes there are difficulties with memories, cognitive processing, those kinds of things. Sometimes people even present with what looks like a schizophrenic illness that's due to a neurological process, and HIV can present that way. So you need to know what the cause is to be able to treat the illness. By the same token, if someone has a significant medical illness, like AIDS, if they have that, then you have to be looking at how both of them are going to interact. If I have AIDS, there can certainly be depression or other things going on secondary to that. It's a matter of treating their depression, but it's not just going, okay, we have an antidepressant, take this. What's going on with their treatment, what the status is of that, all those things will impact on how they're feeling, and it'll impact on the treatment of basically of both. So us treating the depression that somebody with AIDS has will make it easier for the treatment to be successful also.